Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Toro.
And welcome to another episode of What the Health. I am Dr. Dan here with my co-host,
Angela. Welcome back, guys. I'll get the disclaimer out of the way here. As you know, we're here for informational purposes only. We are not offering any individualized medical advice. Always talk to your trusted healthcare provider before making changes to your specific lifestyle. So with that being said...
Excellent. The question of the day. Are you proud to be an American? No, we're coming up with July 4th. No, are you proud to be an average American? The big underlying word there is average. We wanted to talk about this concept, but have you ever been to a healthcare practitioner, and they're reviewing some blood work numbers, and they say, dear Mr. and Mrs. Smith, congratulations. I see that your blood work here or your cholesterol level or whatever it is average compared to other people your age.
Yes.
So yes,
yeah,
right. So
yes.
Many of us have been down that path, and I think that's the question of, well, is that so the follow-up question, which is usually never answered, is, well, what does that mean, or is that a good thing?
Yeah, or if you're above average or below average, what does that mean? Is that you hear about that a lot with, I think especially too with kids, I think back to like the growth charts,
Yeah.
It's like, so I was always above average for height and weight. And it's like, okay, what did that mean? Something was wrong? Or because that's how I always interpreted it. So it's like, or was that just...
That was how you were growing.
Yeah, I was growing faster. Your son, your oldest son's the same way. Oh my gosh.
Yes, he's almost taller than my wife now, and heading. If he gets a growth spurt this summer, we're in trouble. Because, it's really the question of the follow up question.
So what's it mean to be average?
Yeah, so doctor comes in and they say, okay, your cholesterol level is average compared to other people with your age. It's like, well, okay, so does that mean it's healthy? Or does what happens, and this is what we what we talk about a lot with people is, if the majority of people, it's all about the sample size, right? It's all about the group that you're taking. You did research for a while, Angela. We've talked about that before, but it's all about the group size. So if there's 100 people or 1,000 people that they're taking, samples from, and 90% of them have high levels, well, now you've skewed that whole average above what might be normal and healthy.
Yeah.
Something as simple as weight, right? America is significantly overweight compared to the rest of the world.
Yes.
And so if you're only saying, if you said, if your doctor came in and said, well, you have an average weight for, a man, your age. It's like, okay, well, is that sampling out of Americans, or is that sampling in the entire world? Because there would be a massive difference between those two numbers. I should actually look that up.
Yeah,
but I know for certain that America is significantly overweight. I'd be interested in what those exact numbers are. Worldwide average, adult male weight, worldwide average adult female weight. It would be very interesting to look at. Now, again, I know we talk a lot about, it's not just about the number on the scale, but when you're looking at multiple different factors, blood chemistry numbers, weight, BMI, muscle concentration, water, hydration levels, vitamin levels, all of these things are very important to look at. But again, if we're skewing...
what are you comparing it to? Because when you talk about, even, again, coming up with these standard ranges that we look at, those are based off of, again, looking at a range of people, but just because, you might be within the quote-unquote, normal range, but is that what is right for you? Is it, there can still be, again, it's people get so hung up on, trying to hit a specific number for something without necessarily understanding what that means and what it means for you specifically.
Yeah. Well, and there's even, and again, we'll go back to cholesterol just because we talk a lot about it. And again, that's one of those, medications. We're going to get to medication here in a second, but that's just one of those medications that, they forced back from like the 80s and 90s. Actually 1993, they changed the rules and regulations on what levels were appropriate to start giving someone a statin medication to lower their cholesterol. And they changed it from, 240 to 200 with total cholesterol level. That was done by a panel of 10 doctors. 9 of those doctors, we found out, had a direct financial tie to statin drug medication. It's like, now wait a minute. If that's not a conflict of interest, then what is?
They just did it recently with blood pressure too.
Did they really? I wasn't aware.
Yeah, it used to be 140/90. Now it's considered 120/80 is now actually considered high. That used to be considered,
You're kidding.
Yeah. So they're now people, actually I was just talking to a friend last night whose blood pressure is like 130 something over 83 and they want her on medication.
That's disgusting.
Yep.
Oh my gosh.
Yeah, so it's now, 140/90 is now considered hypertension 2. That used to be hypertension 1.
Wow.
And now it's less than 120/80 is normal. So if you have 120/80, they're considering that high.
Wow. So again, so you see how they start to play this game with these numbers and all and again, I would be interested to know
why. Yeah, is it
why?
Were you actually seeing more people with that blood pressure having heart disease? Yeah,
having heart disease, strokes. And that's what's infuriating.
Yeah, because if you're sick, because that should, if in theory, that should be the reason, right? There should be some reason why. Okay, well, because we're now finding that people with this range of blood pressure are having X, Y, or Z outcome, but. Yes. It's, again, without looking at all the other factors, their activity levels, their other, their diet, their stress levels.
Well, not just that, but also just going back to the underlying question of the efficacy, right? Yeah. Risk versus benefit.
Yeah, exactly.
And that's what we have seen over the past 4 decades, 3 decades with cholesterol medication. There is a very small percentage of the population that actually have a net benefit by being on a statin medication. Mm-hmm. The research shows pretty clearly that if you have you've already had a cardiac event, whether it was a mild heart attack, maybe it was a transient ischemic attack, which is another word for, again, a mild stroke, kind of comes and goes real quickly. But you've had a cardiovascular event. Those individuals, and you're male, mm-hmm. then there has been shown net benefit of being on a statin medication, low dose statin medication, that it actually does prevent a second event from happening, But for women, there's been, the research is pretty clear that there is actually a net risk to being on a statin medication long term. Because again, it's like, you might lower your cholesterol level, but people are still dying with, low cholesterol levels with the same amount of heart attacks and strokes. If we have millions, tens of millions of people on statin medication over the past, 3 decades. And if you look at cardiovascular disease, it's still the number 1 killer in the United States. And so if there was really that big of a correlation of taking a statin medication and being able to prevent, heart attacks and strokes, you would have thought we'd seen those numbers, but we didn't. Yeah. And so because we didn't, again, the science is just very clear that it's not the efficacy. It's not providing the benefit that we originally anticipated. So, again, we're getting all stuck on cholesterol, but again, same thing with blood pressure medication. Are we actually going to see what is the benefit versus then the risk?
Yes, of putting somebody with a blood pressure of 130/80 on medication. What exactly is that? Medication that has a laundry list of side effects.
Correct.
And this is someone I know from the gym. She's 63 years old. She's at the gym almost every day, super active, has cleaned up her diet, is just an otherwise healthy person. But because of her age and number, let's put her on let's put her on a medication.
Yeah.
And I was happy to hear she fought back against it, but again, but how many people just blindly go, okay.
They trust their doctor. And again, their doctor's going off the recommendation.
Yeah.
So I don't even blame the healthcare professionals anymore. They're going off the recommendations from these larger governing boards.
Exactly.
That again are just, it feels like they're just arbitrarily changing these numbers without any sort of rhyme or reason to it, other than to get more people on medication. It's infuriating.
Yeah, we're seeing the same thing with diabetes. It's like, again, all these numbers are, they're trying to.
Yeah.
The only thing I see that's changed is more people are on medication. Does that mean more people are healthy?
Well, and there you got to the bottom of one of the big things I wanted to talk about. And again, that's the average, right? The average is more people are on medication. Okay. If more people are on medication, we talk about this all the time. Does that actually mean they are healthier? And if we look at the numbers with the United States, we've talked about this compared to other countries. Compared to other developed countries, we're one of the sickest. It's disgusting. We rank below
and we
Chile.
spend the most
Exactly.
on healthcare.
Exactly. We spend the most on healthcare. Okay. I forget what, in terms of GDP, what we actually spend on it, but we spend trillions of dollars a year on healthcare.
Healthcare. I know. Yeah, we're doing our air quotes here.
Doing our air quotes, quote unquote.
What we do here is healthcare.
It's sick care intervention, right? It's disease management. That's unfortunately what our healthcare system is. But we spend, more money, and yet we rank below other developed countries like Chile and Cuba. Cuba has a better healthcare outcome. You will live longer, and healthier if you live in Cuba compared to the United States. So that's the average. The average in the United States is more medications. But does that mean healthier? Oh, I'm an average American. But does that actually mean you are
a healthy individual?
Yes. And the answer is no, you're not. And if you look at the number of medications. So let's talk about average. This study came out in August of 2019, straight from, I believe it was CDC or U.S. Department of Health and Human Services. I got this right off CDC and Department of Health and Human Services website. If you are 40 years of age in the United States or older, I'm approaching that, I'm not there yet, but if you're 40 years of age or older, 70% of Americans 40 years of age and older are on at least one medication. 70%, over 2/3 of our country is on a prescription medication. Okay. Now, that number, if you are 60 years of age or older, okay, so 60 to 79-year-olds, you have a 22% chance of being on 5 medications or more. 22% of Americans age 60 to 79 are on 5 medications. And I
bet we could guess which 5 they are.
Yeah, so go ahead. Let's say, because look at that.
Cholesterol.
Cholesterol is the highest one. That's the highest percentage one.
Blood pressure.
Yep, that's on there.
Probably some kind of anxiety or depression
antidepressant.
medication. An antacid of some sort.
Yep, pump inhibitor is on there.
And pain, something for pain.
Yep, analgesic and anti-diabetic. But they broke it down into age, and so the anti-diabetic was actually for 40 to 59-year-olds. Yeah. That actually goes away, and you get more into the blood pressure and reflux medication for the 60 to 79-year-olds. Yep. And they break it down in the United States and Canada. But my gosh, this is disgusting. Like this report, I just found this today because I knew we were going to talk about this topic, and all I had to do was go on and say, number of medications, in per individual in the United States, and boom, this article pops up from just less than 5 years ago. And I'm sure it's just gotten worse.
Yeah. Well, and that's the problem too, is when you talk about, so if you're the average American, as we just talked about, the average American over 40, you're on a medication, according to that, at least one medication.
Yes.
So if you're comparing yourself
the
average American, it seems like, oh, okay, well, I'm on, and if you're only on one or two, you might think you're doing
I'm doing pretty good.
And honestly, I mean, you are compared
to 5.
But it's like, so if that's where we're setting the standard.
Yes, we're setting the bar super low or high. I don't even know which direction we're going anymore.
But it's, that's what we talk about all the time. When you talk about average, you're comparing yourself to others. That's where an average come from. You can't, if you do a poll of 1, you can't get an average.
I like to do that all the time. I get vetoed.
Yes. So as soon as you start talking about averages, you're talking about comparing yourself to a group of people. And as we talked about, it really comes down to what group are you comparing yourself to? And actually, we have a whole podcast on where we talked about, listening to the experts. So check that one out, especially some of this research stuff is interesting to you. Because we talk about in there, I worked on a research study where I had to recruit healthy, quote unquote. Yeah, healthy. It was healthy 40 to 64 year olds. And they couldn't be on any of those medications.
Yeah, good
we
luck.
Just listed. Yeah.
So 2/3.
When I saw the recruitment criteria, I was like,
does that exist?
I was like, who are we going to find?
Yeah.
And the people that we do find aren't going to be representative of the 70% of 40 to 64 year olds
Correct.
Who are on those medications. Now we're studying this group who is actually not the average.
Yes.
And we're going to interpret those, and it was a heart study.
Yeah.
So we're going to interpret those results, and we're going to say, see, if you're X, Y, and Z, you have this outcome. Well, yes, but those people were already healthier than the average, as we established. They had to be healthy to get into the study. So they're really only talking to the 30% who aren't on. So that's where, again, you just have to be careful when you start to look in. And interpret research, because it's you have to have a certain criteria to fit into a research study.
Yes.
But then that means
you're already skewing the results.
You can only interpret those results
for
to
those
the people that had that criteria. And that's the problem, because people will say, well, this study said this and this study said this, and why are there so many confounding things? That's why. And that's why, again, when you talk about being average or comparing yourself to the average, you have to look at, well, what was the population that number was pulled from, and do I want to be the average of that population?
So again, it just goes back to the question of, is it healthy, right? It's like, so the numbers are very clear. In the United States and Canada, we take a significantly more medication than, compared to the rest of the world. And then again, the question becomes, is that healthier? And the numbers are clear that no, we don't live longer.
In fact, aren't they saying this was going to be one of the one of the first generations?
Yes, I think our kids. So I'm almost 40, but my kids' generation. I don't know if it was the millennials. I'd have to double check that, but I believe Gen X after the millennials. I'm sorry, Gen Z. Gen Z. Sorry, going the wrong way. Gen Z after the millennials was the one. I have to double check this, but is the generation that is actually losing life expectancy compared to their predecessors.
So why? We have all these medications. We have all this, healthcare interventions. So why?
So we're spending more money, and so our return on investment is just shitty in terms of the United States healthcare. It's like, again, go to another country if you want better health. Unfortunately, that's the reality. Or, as we talk about all the time in the office, you have to become your greatest advocate for your own health and
compare yourself to yourself.
Exactly. Well, and there's even research, again, not to beat a dead horse with the cholesterol thing, but there's even some research out there that shows that different ethnicities have different cholesterol levels. In fact, I remember, I'll have to see if I can find this research again. I know we're not the best with referencing.
I know. In case you didn't notice, we sometimes think of things as we go.
But again, it's like...
Was that the paleocardiologist? I think
that may have been one of them. But Eastern European or Middle Europeans tend to have just naturally higher genetic cholesterol levels. Now, interestingly enough, there's also some research showing showing that people who had cholesterol levels in the 300 and above, they had a significant decrease in cancers and and mental brain fog, which again makes sense because you're looking at some of these studies of people who are on some of this medication long term. They have a significant increase in cancers and dementias and Alzheimer's. And especially, I mean, it makes complete sense in terms of brain health because your brain is 70% fat.
Your brain loves fat.
Yeah, and so it's fat and cholesterol. So it's like you need that to be healthy. And
I would argue too with that. Again, this actually one of our focuses for this month is on gut health, and one of the big side effects of any medication is that it's going to affect your gut microbiome. Yeah. And if you're screwing up your gut microbiome, that's going to start to have a direct impact on your brain health. Right. And so it's just, again, it just becomes this this vicious cycle and then what are they going to do? They're going to put you on another medication.
Well, you have low iron, right? You're on a medication and now your body can't absorb iron as well, and now you have low iron, and so boom, now we got to put you on an iron supplement, and it's just like round and round and round we go. But again, it's like I would totally stop. One of my favorite quotes. It was a life changer for me. I was in the gym with a buddy of mine, and it was early in the morning, and we were working out pretty consistently. And so we were warming up on bench press, and we turn and we see just one of those big freaking guys in the gym, bodybuilder, but he was more of a bodybuilder, but still
can't touch his own head,
working out with ridiculous amount of weight. Like, he had to have over 500 pounds on the squat bar. And, so my friend just kind of like leans over to me and whispers in my ear. He goes, "Comparison is the thief of all joy." And man, did that quote hit me between the eyes, because it's like, you're absolutely, if I'm constantly comparing myself to others, which I later learned out that he got it from, I think it was Theodore Roosevelt.
I was going to say,
was the quote. But, comparison is the thief of all joy. If we're constantly comparing ourselves to others, and where we think we should be, I mean, you're constantly robbing yourself of your enjoyment, your fulfillment in life. But that doesn't mean, so again, if we shouldn't be comparing ourselves in this situation when we're talking about our health to the average. We should be comparing ourselves to what is healthy.
Yeah.
And I think that's where, unfortunately, I don't think many of our, large governing bodies have done a good job answering what is health.
Yeah.
Because it doesn't serve the pharmaceutical industry and their pockets. And again, it's so freaking tied into, even everyone who has a retirement plan guaranteed has, a fund or, some investments that are tied to pharmaceutical industry. And so you're really funding our own unhealthiness.
Yeah, and when we talk about, again, trying to be average or comparing to others, at the end of the day, it's, our bodies, we all know when we feel good. I mean, we have a podcast on that, our Stop Battling Your Biology podcast, which again is really just about listening to your body and your body's signals instead of blindly following whatever the thing is. Because again, you have to remember too, research takes decades to come out. Yeah. So by the time recommendations are coming out, that research is already 10, 15, maybe 20 years old. So it might not even be relevant anymore in the current, especially with how quickly things are changing on a day-to-day basis in our, in our life, in our environment, in our world. So, you really have to be careful when it comes to research and just blindly following recommendations, especially if it goes directly against something. If I tell people all the time, like, if you've been doing something your whole life and you feel good and you feel healthy and you feel energetic, and some now, Joe Schmo, who's, whatever says,
Joe Schmo PhD.
This is bad for you, and this is killing you, and da da da. I'm like, well, I guarantee you, Joe Schmo is trying to sell you something. So, and again, as everybody is, that's the world we live in. But again, really, really listen to yourself, because again, we talk about patients coming here all the time. They'll be like, oh, I finally feel normal again, or I feel like me again. And that's, that doesn't necessarily mean that they have the same numbers or the same experience as anybody else. It just means finally whatever was feeling off has now that just feeling. We all know when we just feel off. We all know when we're getting sick or something's just not right or something's, nagging on us from a mental or emotional side. We know when we power through because that's what we're told to do. But
and again, that's a fantastic point, because you go back to, I just feel off. And that is so much of today's, what we, deal with coming in our office. It's like, yeah, you can point out some aches and pains, but again, it's just, a lot of times it's just generalized aches and pains. It's brain fog, it's fatigue. But if you were to go to your medical doctor and, they have to go through a specific checklist, you may have completely normal, quote unquote, blood work. You might, because you're average, you fall between the range. So your blood work might look completely normal because either you haven't had, what's off hasn't had enough time to accumulate long enough to show up on a test. I always use the example of, cancer or heart disease, right? Yeah. You don't develop heart disease overnight. It takes probably a decade or longer for an artery, a major artery, to build up enough blockage to give you a heart attack or a stroke. Same thing with cancer. It takes several decades. A tumor just doesn't show up overnight. It can take a decade or more for a tumor to grow big enough to be detected on a scan. So, when we're looking at these tests and stuff, you may, your test may come back completely normal or within the average range that's been established by a governing, medical, elite leadership group or whatever. But at the end of the day, you still feel off. So, there's some alarm or signal telling you that, hey, something needs to change, okay? Because it's not the same as it was. And that's where, looking at things differently and asking different questions can make a major, major difference in trying to establish what is healthy, not what is average.
Yeah. And I think, unfortunately, again, as we know, the average American's on these medications, which means they're dealing with these things. And I think, unfortunately, a lot of people's quote unquote normal has become being in pain, being tired, having brain fog, that's
the new normal.
And that's when we have the people that are like the unexpected side effects are the ones that we love. And we actually, in our outcome assessment where we track this, periodically ask people about, okay, well, here's what you came in for. How are those things doing? And then, hey, by the way, anything else going on? And it's like, oh, well, yeah, I'm sleeping better. I have more energy. I have things that people didn't even realize because that was just their normal. Just, waking up and feeling crappy was just...
Yeah, feeling like you needed 3 cups of coffee to get moving.
Yeah, and all of a sudden it's like, oh, wow, I'm just
I'm sleeping better.
I feel good.
I'm pooping better.
My mood, suddenly people don't mind being around me.
Suddenly my wife finds me attractive again.
Maybe we should be sending these to spouses and children.
I've thought about that. I have thought about that.
But it's sad when, again, the normal becomes, or, again, if you're considering normal being what's average, then...
And how many times do we just hear I'm just getting older, right?
Yeah, all the time.
But again, it's because we have brainwashed ourselves in America that
to think being old means being...
I'm 40 now. So, and again, the statistics show if you're 40, 70% chance of being on one medication. Yeah. It's like, so that then becomes the excuse, right? All my friends, family, colleagues, peers, they're all on a medication. So, my blood pressure's a little bit borderline, so better start that blood pressure. Oh, my cholesterol's a little bit borderline, better start that statin medication. And it's and now you get the side effects, which only accumulate over time. And so before you know it, it's I'm just getting older and, this is how it has to be.
Yeah, as opposed to asking why. Because, yes, there are absolutely physiological changes that happen.
Yeah, so a 70-year-old is not the same as a 20-year-old. We're not denying that.
So instead of asking, okay, why is this, I hit this age and now I'm experiencing this. So, maybe I need to change my diet. Maybe I need to change my exercise. I need
to get my spine adjusted.
Yeah, the workouts I'm doing now, I guarantee you I will not be doing when I'm 50 or 60. So, maybe we need to make some, make changes. And instead of, again, I think heartburn's a big one.
Yep.
Everyone, I joke too. Everyone, I remember it was our brother. We have a brother between us. And he made a joke like, oh, wait till you turn 30, you're going to get heartburn. I'm like, haha. And I was 28 at the time. I'm 2 years behind him. I swear it was like the week of my 30th birthday. And I'm like, what is this feeling? And it was, and periodically, it flares up. But again, what?
Usually it's around eating or drinking late at night.
Yeah, like and yes, it's things that I used to be able to eat and drink. But again, so obviously after 30 years of, my gut microbiome, something's changed. It's not able to process, the spicy things. Oh, it's always worth it though for that. Maybe not able to process the spicy things. Or again, if I do too much coffee or, it's just, but again, the average person my age would do what? Would take a pill. Pop those Tums and do it again. Yeah. And I'm like, okay, well again, not being average, happily not being average. If I'm having that feel, I'm like, okay, what did I eat? When did I eat it? What was I doing? Yeah. What caused it so that I don't repeat this? Exactly. and recognizing that and, getting to the root of why are you having these issues so that we can naturally address them. Yeah.
Yeah, and that's and again, I know we harp on this all the time about the becoming your greatest advocate, and it's like, there are so many resources out there, and I hope you have a good relationship with a primary care provider. A lot of people, I think there's more and more people starting to choose, like their chiropractor as their primary care provider. I know that we have a lot of patients who come in and they consider, us their primary care provider because, again, they don't want to jump to the medication. Again, medication has a time and a place, but that is not what they want to do as their first resource. Because, again, that was the other thing I was going to bring up with this study. It's like, every one of these medications is for a preventable disease, a lifestyle preventable disease. Mm-hmm. So it's like, instead of, sitting there having the conversation, and again, what's a medical doctor do? And I don't fault them for it. It's the system they're in. Yeah. They don't have time to talk to people because they have to see a certain number of people and write a certain number of prescriptions so that they can meet their overhead and pay their staff. And again, that's how their system is built upon. It's a sinking ship, unfortunately, and it's not going to, continue to maintain for, long, because they're not getting people healthy. Yeah, right?
I'm happy to hear when they do try to address those things. I was working with one patient and her blood pressure was up, and her doctor actually talked to her about increasing water intake and and actually address the activity and some lifestyle, some of the stuff that we've been working on. So I was happy to happy to hear that, and because again, that's not that's not always the case. So
and I think we're seeing some changes. Mm-hmm. I think some and again, it should. We talk about insurance. We don't talk a lot about insurance, but again, we're so stuck. Society is so stuck on, well, if my insurance covers it, then I'll do it. But unfortunately, we are in this transitionary time of we have to. If you truly want to be healthy, you need to spend money on things that are not covered by your insurance.
Oh yeah, I say that all the time. I was telling people about the hip injection, the PRP injections I got, and everyone's like, that was covered by insurance? I'm like, absolutely not. No. But it helped.
Exactly. And you were able to compete and do the thing that, brings you a lot of enjoyment in life.
Because the medical system, backstory, I have a torn labrum in my hip. And
hopefully it's healed by now.
I think it's probably not 100%, but the only solution to that in the medical system is surgery. Yeah. And surgery would 100% take me out of competing. So it's, and not necessarily take away the pain, because that's what I talked to somebody from the gym and had the surgery, and even she was like, she's like, worst decision of my life. Yeah. And so I was able to find something that actually fixed it. Yeah. But insurance didn't cover it. Yeah.
That was an investment in your health. Exactly. And that's what, that's what I love working with people. We are, most people know this coming into our office. We are 99% self-pay. We just don't deal with third-party insurers. Yeah. And because we're not reliant on that, we are able to sit, have conversations, spend the time and make the recommendations that are truly going to help you get healthy. And if we don't get results, people are paying us money to do that. Yeah. If we don't get results, they get to take those dollars somewhere else.
Exactly, yeah.
If you just only go to where your insurance is going to cover you, well, first of all, you're going to go in to a practice that is beholden to the third-party payer. Mm-hmm. If they don't follow their rules, then they don't get paid. And so, and again, if you don't get results, it doesn't really matter to you. Yeah, you want to feel better, but it doesn't matter to you as much because you are not physically paying out of pocket for it. Yeah. And that's why I love what we do, because we work so hard to find the underlying causes of, your health, to give you true solutions to help you get healthy. And by doing that, people then, reward us with the value of their hard-earned dollars. And it's made for just a really, really beautiful environment in terms of, and again, we are such a microcosm of healthcare, but, we've created such a beautiful environment for people to come in and say, I want to get healthy. I feel off. Yep. I have not found solutions with, my medical doctor. Again, I just went through this.
You've been listening to What the Health with Dr. Dan and Angela Toro, brought to you by Toro Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.